I couldn't believe that this kind of a program was even available. It's definitely extended my mom and dad's life, and it's probably extended mine too.
We derive satisfaction out of watching people being able to stay at home and live the last years of their life out in the community and the place that they want to be.
They don't push you aside. If you have a problem, they are there to take care of it.
They're just great. They're so caring. You can't believe how nice they are. It's just wonderful.
You know them more than just as a diagnosis, just as somebody that you're treating. And we actually become like a really big, huge family.
There's no sadness, there's only love, a lot of love there.
My life is totally different now that I have found PACE.
It's bright and early on a Monday morning, and 81-year-old Teresa Arzaga is raring to go. Until recently, though, she hardly ever left the house.
I have arthritis in my shoulders, arthritis in my knees. I couldn't walk. I was just sitting here in nightgown. I didn't even bathe myself or take care of myself. I used to ask God to take me, that I want to die. I used to be very upset, very lonely and very upset.
But not anymore.
Buenos días.
Several times a week, a driver for the PACE program comes to pick up Teresa and take her to a PACE center where she'll spend the day.
Good morning, Paul. How you doing? My driver, he helps me. He puts me in the van. He puts us music. He said, what kind of music you like? So he said, way back, so he has the cassette saying, everybody's singing. And then when we get there, we're here. Oh, we're very happy that we got in to our second home. We're very happy.
At the PACE Center, Teresa does crafts,
We follow what they tell us to do.
attends a meeting with social workers,
Thank you.
has lunch, and sees a doctor. The program serves older people like Teresa who need long-term care.
In a sense, it's a one-stop shopping model and doesn't let them get lost in the system of social services.
That's possible because of a team approach to care.
We went to visit her yesterday, and she told us that she felt better.
Several times a week, there's a meeting of PACE professionals, including a doctor or nurse, physical therapist, social worker, and transportation coordinator, to discuss the care of participants like Teresa.
She's being seen right now in physical therapy for her knee and also is riding the bike a little bit. Is there any problem with her continuing to do that while she's on the medication?
I think if a problem does come up, an issue comes up, it's discussed from different points of view. For example, we have the social worker that can communicate with us if a patient is not feeling well, is looking different, is not eating well. Any change in status, we know it right away, as opposed to weeks, months in a different type of setting.
That means people like Teresa stay healthier and out of the hospital. Thanks to physical therapy and social support provided by PACE, she can now walk without pain, and her depression is lifted.
Oh, I'm so happy. I have a lot of friends, a lot of people that love me, and I like to fix myself now. Everything, you know, there's a lot of love. No, there's no sadness there.
The changes in her life with this program have been, they've just been really, really incredible.
Teresa's son, Tony, is responsible for her care.
If it weren't for the program, unfortunately, and this is one thing I always said I would not want to do. She was wheelchair bound, so there would have been no other option but to place her in a facility.
In Teresa's case, the PACE program provides a nursing aide several times a week to help her around the house. That, combined with trips to the PACE Center, allows her to continue living at home.
She's getting, I think, care that I wouldn't be able to do it on my own, even as hard as I could try. So it's a big relief on my part that I don't have to be constantly monitoring her during the day.
The PACE program gives the same peace of mind to Bonnie Jensen. Her husband Stan suffered a stroke 8 years ago and lost the use of his right arm and his ability to speak. Until she found PACE, Bonnie was Stan's full-time caregiver with no outside help.
I couldn't see a light at the end of this tunnel that we were in. I got to be kind of grouchy, and I was crowded. I had all these decisions and all these things I had to take care of, and there just weren't enough hours. And now I have people helping me, and I didn't think there were people to help me.
That help comes from the PACE team, which holds regular family meetings with Bonnie and Stan.
It is just the pressure that is taken off of you. And they do it all. And they do it, again, before I can even ask.
I understand that we did install some sticky stuff on the bottom of your bathtub, and it didn't hold. So we'll come out there and redo that and see if there's something else we can do.
Working with participants and families like the Jensens to address their home needs is a key part of PACE.
And then we're giving flu shots this week. So you'll be getting your flu vaccine.
Initially, Bonnie's biggest objection to joining PACE was having to give up Stan's doctors, but that concern quickly faded.
The doctors I have now are just as great as the doctors I have had before, if not better.
And to make the L sound, you have to make the tip of your tongue go up behind your teeth. La.
In addition to medical care, Stan gets speech therapy at the PACE Center.
Lake.
He also spends time socializing with other men, something Bonnie thinks is important.
I think even though he can't talk, just seeing what other men do, you know, and how they laugh at the football game or whatever they're watching or the movie is something that he really wasn't getting here at home.
But it's not just Stan who gets social support. So does Bonnie.
So we have, extra concern for you.
Social worker Roseanne Cole pays close attention to Bonnie's needs as a caregiver.
It's so important for you to take care of yourself. That's a lot of what I do with her, is talking to her, affirming that she has needs as well as Stan, and helping her feel more comfortable meeting her needs so she can meet Stan's needs too.
We have now been able to adjust to what has happened to our lives and know that there are people that care about us personally and will be there for us for the remainder of what lies ahead for us.
Hi, Cheryl. How you doing? How are you?
Knowing that people are there for her has made all the difference for Shirley Neal.
My life is worthwhile now, and before it wasn't.
This was Shirley just 3 years ago. She had asthma so severe she could barely walk. Her weight had dropped to just 88 pounds.
I was really about ready to cash in my chips, and because I just lost a daughter, and I was drinking excessively, and I just didn't care.
With the help of the PACE team, Shirley's outlook has dramatically improved, and so has her health.
It's like a big family, because they don't push you aside. If you have a problem, they are there to take care of it.
And then pull it down.
Okay.
Hi, Shirley. How you doing?
2 days a week, Shirley gets help at home from a PACE nursing aide.
Oh, it's better.
And thanks to PACE-provided transportation, Shirley doesn't have to worry about how she'll get to medical appointments anymore.
They have the drivers that'll take me. They come and pick me up, they bring me home, and if I have a health problem, if I'm not breathing good, they'll send somebody for me.
Okay, and we'll start off with up on your tiptoes, okay? 1.
At the PACE Center, Shirley gets physical therapy, something she's done regularly since starting the program.
Shirley was able to work with therapy and make initial strength gains, learn how to use the walker, and then be independent with the walker. And then we've just continued to see her, and she's maintained and improved over time because she just comes and consistently participates in the exercise.
That chance to keep going is one of the things that sets PACE apart from standard care. In other settings, therapy typically stops once people like Shirley reach a certain point.
Here, we're allowed to continue with the person and work with them in their maintenance program. So a person will achieve their goals of being independent and fall free, but they can still come in and use all the equipment in the gym and work with our staff, and we can keep a close eye on them and make sure they're still exercising and staying at a high level.
If you look at these tests here, which we just took the other day, you see they're all normal.
All decisions about care are made by the PACE team of professionals in consultation with families and participants. No outside approvals are needed.
It's all based on what individuals need. Our success is how well we can keep them at home, how well we can allow them to live the last years of their life in the settings and surroundings which they're most comfortable and most familiar.
And when that requires more care, the cost for a participant does not go up.
And if you'll take some deep breaths with your mouth open, Shirley.
People like Shirley get all the services they need, including prescription drugs, for a set amount of money each month. In many cases, the entire cost is covered by Medicare and Medicaid.
Sounds good.
I think it's fabulous, because if I had to come up with the money for the medicine I have to take, it would be devastating.
Shirley, Stan, and Teresa are thankful for a program that has made such a difference in their lives. A program that addresses all their needs and allows them to continue living at home, surrounded by people who care about them.
All of them are beautiful, and I'm a very happy person.
They care about me. That's the main thing.
It's just absolutely a wonderful program.